Hello Protrusive and welcome to this clinical tip series. In this video, I'm going to show you how to use the mighty powerful Hemostatic Oblique Wedge technique. So anytime you have some bleeding gingivae or a bleeding papilla, how to very quickly and very effectively stop the bleeding. This technique was taught to me by Dr. Sunny Sadana, and I love it because it's cheap, right? Everyone's got access to wooden wedges and it's very, very effective. Let's dive right in. At this stage, as you can see, there's a lot of bleeding. So this is really obstructing my vision. This is really annoying. There's too much bleeding. I'm not happy about this level of bleeding. And so let me show you how I use the Hemostatic Oblique Wedge technique, okay? So I know the bleeding is more mesially. So what I'm going to do is I'm going to stick the wooden wedge in, not straight, okay? Not straight like normal, not like that, okay? But I'm actually going to angle it upwards, okay? And go in a more oblique fashion. So I'm angling that wedge in a little bit more, and it's actually compressing right into the gingiva. It looks pretty straight here actually, but remember when I was doing it, I was at an angle, so I was at a bit more of an angle than going when you traditionally go in. Okay, so instead of the normal way, you're just angling it down. The tip of the wedge is being angled down towards the gingiva a bit, right? And you can see here how my wedge is very much subgingival, right? It's actually wherever that annoying capillary was that was bleeding too much, I have completely compressed it, okay? I have strangulated that capillary, and look at it, it's pretty much instant, right? How cool is that? That we just stopped all that bleeding without anything fancy with just an orange wooden wedge. So there we are, the bleeding is stopped. I can now breathe and really assess properly. Well, there we have it, guys. That's the Hemostatic Oblique Wedge technique. I did promise this a while ago in a Protrusive episode, so apologies for the delay. Wishing you a happy new year. And if you liked that video, that was a small snippet from a full clinical walkthrough I did for Protrusive guidance. So for those of you on the Ultimate Education Plan, you have full access to that. If you head to protrusive.app and check out the premium clinical video section, you'll have the walkthrough series, which is exactly that. It's a point of view walkthrough series of me in an engaging way, because I ask you some questions and I tell you about the history and we come up with a diagnosis together. And in this particular case, it was investigating a premolar, which I thought was unrestorable. But before I condemned this tooth for an extraction, I investigated the crack, and as part of that, as bleeding too much, I couldn't see, so I used the HOW technique, as I just showed you, to very efficiently stop the bleeding. But if you want to see the whole thing, including the diagnostics, the thought process, the exploration of the crack, the extraction, and what the crack looks like at the end, then do check out the full video. Do show your full support by going to protrusive.app, or if you want to go straight to the Ultimate Education Plan, the link is below. It's protrusive.co.uk/ultimate. That'll take you to the right place, and I'd love to see you join the nicest and geekiest community of dentists in the world. Look out for more this year. Don't forget to like and subscribe.